Welcome to Healthcare Quality and Risk Matters. Wondering about patient safety, quality, and risk management, but aren't sure who to ask or were afraid to ask? Well, you're in the right place. We've created a safe and judgment-free space to explore these critical topics to leave you informed and inspired to make a positive impact on healthcare. So, let's learn and grow together because healthcare matters.
Well, good afternoon, everybody, and welcome to the April installment of Healthcare Quality and Risk Matters. My name is Gary Bierc. I am the CEO of Aperitisoft Healthcare, and I am joined by our regular panel, Rob Santamoor, our Chief Operating Officer, and Dr. Timothy Brown, who is our Vice President of Healthcare Solutions. And we're excited to have a guest today. His name is Neal Harper. He's the CEO of Digital Armor. Good afternoon, Neal. If you guys are new to our broadcast, I'll give you a little background on the panelists. I've got some 40 years experience in risk management. I am not the healthcare expert on the panel, but I am the risk management expert. I've done just about everything you can imagine in risk management, including a fully integrated enterprise risk management program. I've got an MBA, so I'm more business educated. We have Rob Santamoor, who is a registered nurse. Rob worked bedside for a long time and has done different areas, both in Donate Life as well as in hospital environments. But he transitioned into quality, and I'm going to tell you that Rob is probably the Encyclopedia Robetica when it comes to quality. He is amazing in different aspects of quality that he has worked in. And he'll give you a great perspective on how we look at cybersecurity today. And we have Dr. Timothy Brown. Timothy is a PhD in hospital administration, but he also has an MBA. So he's going to be giving us a hospital business perspective today. Both Rob and Timothy have over a decade, almost 2 decades worth of experience that they bring to the table. So I think you'll be impressed with what they have to say. And our special guest today, Neal Harper, not only is he CEO of Digital Armor, but Neal comes to us with a huge amount of experience. He is a retired commander from the Navy, where he spent 30 years in cyber warfare. But he also has some 20 years experience working with the C-suite in both healthcare, defense industries, private equity firms. He's going to give us an expert's opinion on cybersecurity today, about the attackers that are out there, and make it relevant for us for healthcare. One last thing, today's topic, as you can imagine, is cybersecurity in healthcare. Just to give a little bit of an understanding of our format, we begin with an incident of the month, which Rob is going to be sharing with us shortly. We follow that with what we call Minute Matters. So Minute Matters, we're going to be throwing questions at one another, but the answerer is going to be limited to 1 minute to answer that question. We'll wrap that segment up with the last word, which we're going to throw that at Neal today, so he'll get the last word in our broadcast. Throughout the entire broadcast, guys, please go to the chat and put in your ideas, comments. We would like to include those in our conversations, but also try to address them by the end of our broadcast. So with that, Rob, we're going to tee up the incident of the month. So what is the incident of the month?
Hi. So it was unfortunate the number of incidents that I had to choose from. But one of the largest in the media right now was the United Health Optum hack that happened back in February. The ransomware.
Big news, yeah, big news nationally.
Yeah, the ransomware attack by Black Cat hacker group, if that's what you call them, a group, right? So they hacked into Optum's patient billing and care auth portals. Which created quite a few downstream effects, not just for that organization themselves, but also for patient outcomes, right? So we saw backlogs in prescriptions, pre-auths for patient care, leading to delays in patient care. As much as going to the patient or the employee payroll of Optum, there's an affecting their
Wow.
payroll, costing the organization about $100 million a day. There's until they paid the $22 million ransom that they had to pay to Black Cat. There's to then essentially restart. What a big event that just impacted so many people. And from a quality perspective, how awful that all of those patients had to wait for care, which increases morbidity and mortality in those patients.
Wow.
So Neal, I'm sure you're familiar with it, being a cybersecurity expert. What kind of commentary or color commentary you can give to us on this incident?
Well, I think it's a couple things strike me. You know, it's further evidence that healthcare is still the number one target for hackers. Has been for quite some time. I think in 22, education took the top spot, and that was really a result of all the remote and online education that resulted from COVID. But healthcare has been number one for a long time, and you can understand why. I think that same report, something like 6 terabytes of patient data was taken, despite the ransomware payment. I know that they estimated it cost, as of last week, about 872 million.
Wow.
But they project it could be as high as like 1.3 to 1.6 billion this year.
Crazy.
And so it's at the same time, it's all relative, right? I mean, that's a huge organization, obviously a big target with resources to handle it. But if you're a small healthcare provider and you are subjected to the same kind of attack, you may not survive. I mean, frankly, it's just it can be catastrophic to the organization. So one would think that organization of that size has all the resources to implement all the security measures needed to prevent something like that. But at the same time, there's a huge body of evidence that tells us about 91% of the cyber attacks start with a phishing attack. You know, 1 out of 5 people are going to click that link, open that attachment, and let the hackers in. So I think it just reinforces the idea that we're all targets, healthcare especially.
Is it because of the resources hospitals are perceived to have? Is that what your opinion is why hospitals are number one? Or is it because we in healthcare don't do it well?
I wouldn't say that, you know, across the board. I wouldn't make that assumption. I think it's, you know, the value of the data. You think when you go to when you become a new patient, you give them your life story. All your health information, your financial information, social security number, et cetera. It's all in that data set that they manage. So I think that's, you know, the hackers are after data. There's a huge black market, you know, dark web for personal information, you know, financial and health.
Yeah, we think about like this Black Cat group. My understanding is that's the same group that shut down Vegas. So one of the casinos paid the ransom. I think it was a $10 million ransom, and they did it right away. MGM Grand refused to pay the ransom, and it cost them hundreds of millions of dollars to fix the problem. So you're dealing with real criminals here. Obviously, it's like the new mafia. It's the new mafia out there, and they're predators. I mean, they're looking and working very hard and diligently. They have employees that are doing this full time, trying to find ways to break in. It's shocking, and we lay people don't realize this is going on every day. We're using all this technology and we're enjoying it, but we don't know just how exposed we really are.
You know, I think about the bigger impact when you talk about what the overall disruption that happened for the organization. Rob, you mentioned this earlier. payroll was interrupted. We're talking about patient flows that were interrupted, leading to things such as an increase in overall mortality. And from the research I found, there's a potential increase of nearly 21% in mortality for patients in a ransomware attack. So think about that for one standpoint. There's 4 people on this phone. There's literally one person now in this conversation that could potentially be exposed to mortality because the hospital cannot do what it needs to do in the event that they are attacked ransomly. So it's just a major impact to the system. And Neal mentioned this earlier. It could mean for smaller health systems, that could be the one thing that happens that shuts your entire system down. So
now that's a great comment, Timothy, to transition to Minute Matters on, because this is it's scary to think about. These guys are real criminals. I mean, this is evil. I mean, they're killing people, right? They're human beings that are being affected by this. So, Neal, it's our custom to put the guest in the hot seat first.
Absolutely.
So I'm going to throw out to Rob and Timothy. Won't you guys come up with your first question for Neal? And Neal, you got exactly a minute to answer the question. If you get down to about 10 seconds left, you're going to hear a little tone. I don't know if Rob, you can play that tone just so the audience can hear it.
I would love to.
Awesome.
Yes, you're not having a deja vu. You're not in the airport. That was the airport bell. So Neal, if you hear that, you know you got 10 seconds. Okay. All right, Rob or Timothy, who wants to go first?
I can jump in there.
Go ahead. I'll let you go.
Sure. I'll go easy on the first question now. How are healthcare organizations addressing cybersecurity threats to safeguard patient data and ensure quality care delivery from your perspective?
Well, obviously, there's a mixed results on what they're doing, and large or small. We hear about the large ones who we assume have the resources to do all the things necessary, and yet they still get hacked. What we don't hear about are the mid-size or smaller organizations, and that's not just in healthcare. That's across the board. I mean, there's thousands of attacks occurring every day. And I think the awareness is growing, but it's still not there. It's an educational process to understand, the risk and the impact. A lot of business owners and even, C-suite I talk to just, don't recognize, what the risks really are and what the impact could be on their organization. I think, HIPAA has been around for a long time, so perhaps healthcare is more aware of the requirements to protect, private health data, and have done a lot to do that. But I think it's still a challenge.
You didn't have to stop on the tone.
I was like, and right. So if I could piggyback off of that question, and so there's our company as well as yours, right? We believe in proactive risk management. We want a high quality, high reliability organizations. What are the best ways that hospitals can safeguard themselves? What exercises can they do to make sure that what they are putting in place is effective?
Well, I think Gary would agree with this, that, and I've seen this in print. It's not my idea, but I've experienced it, that a comprehensive risk assessment is really the cornerstone, and a risk analysis. Not only identifying the threats, vulnerabilities in the system, and then the probability of those, so that you can prioritize, what really truly needs to be addressed. What's a high risk issue, medium and low? That's typically how it gets reported, and be able to prioritize a plan of action to close those gaps. So having that first and foremost, because you don't know what you don't know. And, I come in, and recommend a third party, not even myself. I use a partner like Gary, or other companies to do that analysis, because everyone has blind spots. You could think you've done this, and this previously. Everything looks like it's working well. We feel like we're protected, but everyone has blind spots. The environment changes all the time. Threats change constantly as well. So having that third party take a look and then getting those results and being able to plan accordingly.
I've got a great question for you, Neal. You mentioned earlier that the C-suite, they just don't understand the risk. How would you present that information to them? What would be the best way for them? You know, people always joke around with C-suite, you got to do things in crayons, but but what
we did the same with admirals and generals. You know, you had to boil it down to a few points on a PowerPoint slide, and then
very very large font that they can't see anymore, right?
Right.
But how would you feel would be the best way to get their attention with this?
Well, first, I wouldn't generalize. I think plenty in the C-suite, get it or are getting it. But it's really, again, talk about the risk assessment, but be able to articulate that in a way that identifies the true risk and the impact. The C-suite's less interested in technical controls and technical solutions. They want to understand, if we don't do this, we've identified a risk, a vulnerability. If we don't fix it, what's the impact? That's really the bottom line. And it comes down to a business decision at the end of the day. Do we have the resources to implement the right solution to address this vulnerability or mitigate this risk?
So, Neal, let's turn the table. You can ask one of us a question now. Let's put us on the hot seat.
Well, I hadn't prepared any questions for you guys, but from your perspective in healthcare, I mean, I'm curious, what are you seeing as to what's being done? Tim, to your point, what is being done in a general sense that you've observed in your experience in the healthcare industry with respect to security?
So something that's done or not done, I guess, right?
Yeah. So from my experience, we have third-party audits. We have our annual requirements per regulatory standard, right? You have your HIPAA assessment that you have to complete. There's for privacy and security. And then we have our contracted audits through our EMR providers. So whoever's doing our electronic health record or medical record, we have those assessments that help protect the hospital patient information. And then we have some internal measures, right, that we're doing. There's, as far as like education, there's support, awareness, and testing. And I say testing, and I do mean that loosely. So we'll get like an email, right, that says something somewhat arbitrary or tricky to try to get you to click on it and to like test our education for phishing.
Good.
But also in my experience, from a risk and quality standpoint, that role has fallen on my shoulders, and I am not a cybersecurity person. So I'm relying on those other organizations to provide that resource, that reference, and I do not have the ability to validate that information. So I would venture to guess that we're not doing it really, really well.
Rob, you're very kind in how you strategically put that. I'm just going to go there, Rob. We are a very reactive industry when it comes to healthcare. So everything Rob said is the ideal healthcare system that many are doing to kind of mitigate the risk. However, we are pretty much exposing ourselves at the end of the day because we're putting all of that information and those tasks on people who are not necessarily trained. As Rob said, he's quality. However, he's not cybersecurity, he's not IT. Those roles generally just trickle down to the person that understands it the most versus the person that is fully trained and well versed in how to kind of mitigate these overall attacks. So at the end of the day, we do the phishing test. We provide annual training. We in a way check the box. However, at the end of the day, we're still exposed and vulnerable to many of these attacks, because if there is one new employee that forgets to, complete their annual training, or they've done the training but still click on the email, it leaves the door open for anyone and everyone to get in. So we're very reactive as opposed to that proactive approach. And I think we could do a lot better in that.
And Timothy, I want to reiterate your check the box situation. So I have even turned over my third-party audits for cybersecurity to our regulators. Some significant regulators. There's who check their box that it was done. And they,
that is the downside, isn't it? When you're heavily regulated, it seems that both risk and quality become a compliance exercise rather than a proactive value add aspect of operations. And that's where we've mentioned this in the previous episodes. Enterprise risk management is about making risk management part of the decision making of the organization. And, I firmly believe, after learning from you guys, that really risk and quality need to be under an enterprise risk management perspective in hospitals. And cyber would be part of that. That way management can see the full portfolio of risks that they face, not just cyber. But then it puts emphasis on getting quantification on risk brought to the board and to the CEO level. I mean, I was fishing from you a little bit, Neal, earlier to see if you would talk about dollars terms, because one of the conditions of C-suite is they always speak in dollars and cents. And if you can't bring information to them in that perspective, they have a hard time grasping the gravity of the situation, right? And that's something I think that if we were going to recommend to any hospital group out there, is learn to speak to the C-suite in their language. Bring forward what needs to be done. We at Aperitisoft Healthcare, we've provided an assessment engine capability right in the software that would allow for a cyber risk assessment using Monte Carlo simulation and creating what these expected value impacts could be in dollars terms. So the technology's there, just need to seek it out. Right. Okay. So what else we have for Neal before we transition to the Q&A?
So Neal, I don't have a direct question. But I do just want to share my perspective with the audience from a quality perspective on cybersecurity and the downstream impact that it has on patients. And we discussed that a bit as we introduced this and talked about the delays in patient care. Dr. Brown, the 21% increase in mortality, but there's that's massive. The downstream effects, though, are nurses and doctors not having access to what they know for documentation, not getting prescriptions to the floor, not being able to access patients' past medical history. And I could go on and on about examples all day that increase. There's the length of stay for a patient. There's increased the amount of time to get the patient care that they need, treatments and drugs, right? And the long-term effects that it has from the patient's health. There's, as well as nurse burnout and physician burnout, is massive. And it spreads on for a long time. I have supported organizations in the past that went through a ransomware and they were still paper charting like it was 1996. There's a year later. Wow. And the effects that it had on patients and nurses in recruitment. They were not able to recruit nurses when nurses found out they had to go back to paper charting. And so the detriment to hospitals is significant, but the detriment to patients is enormous. And that is what we hope cybersecurity will increase and we will start doing it better, and we will start doing risk and quality better, so that our patients don't have to suffer because we're not there yet.
Well, Rob, that's a good transition to the last word. So why don't we give Neal the last word on cybersecurity before we take questions from the audience.
Awesome.
So, Neal, what do you think? What if you're going to leave a parting gift to our audience, what would you leave for them?
Well, first of all, thanks for having me, Gary. I've really appreciated getting to know you personally and professionally the last few months.
Thank you, Neal.
The fact is, cybersecurity is changing. The landscape is changing. The threat landscape. As we said, healthcare is still number one target. So it just makes it that much more challenging for us to find, the right solution. I say the right solution, what's appropriate for the organization, but is effective at the same time, all coming down to resources. You talked about return on investment. One thing I've started doing is as we say in the IT world, kind of flip the bit on that. So in this breach that United Healthcare had, 872 million, maybe as high as 1.6 billion cost of that breach. So if they'd invested $100 million more in cybersecurity and prevented that, that's a 8, 10, 16 to 1 return on investment. Maybe that people don't want to accept that, but that's an example that could be used.
Yeah.
Would it have prevented it? Well, we don't know. We sure hope so.
Mm-hmm.
But as the landscape changes and gets more challenging, the government response is, let's put more regulations on it.
Yes.
But I don't know if that's the right direction, Neal. I mean,
it isn't, but it's happening in multiple industries from the regulatory standpoint because of the cost of breaches and ransomware. The requirements are being elevated. HIPAA just released a new publication. NIST released it, implementing the HIPAA security rule, and it's a cybersecurity resource guide. And I would point anyone in our audience that's in the healthcare business to get a hold of that. It actually does have some good guidelines and recommendations for implementing all the things you need to do to be HIPAA compliant from a security standpoint. And it talks a lot about reasonable and appropriate, because it's not a one size fits all. It has to be proportionate to the organization. So, I would say, bottom line, if you haven't done a thorough, comprehensive risk assessment, do one sooner than later. That will help identify those existing vulnerabilities and help prioritize resources. And have a third party do it, because we all have blind spots, like I said earlier. Have a third party do it, get the results, sit down, go through that, and prioritize how you can improve your security program. If you don't have the budget for a chief security officer, get a fractional one, get a virtual one, someone who can be responsible for implementing that security plan. In response to this breach we had, the HHS secretary said everyone, and I guess he meant everyone in healthcare, should be asking themselves what we can do to prevent this type of attack or this event happening to us if we're a target. Well, we're all targets, right? So we're all being targeted.
Yeah. So we have a question from the audience, Neal. I think this would be a good follow-on to what you're saying there. It says, what percentage of your clients take proactive measures, like creating an incident response plan and or perform a tabletop exercise for a cyber event?
That's a great question.
Thank you, Casey.
Not many that I've run into when we first meet, but after we do the risk assessment and show them what the vulnerabilities are, and address those and build out the roadmap to address the high, medium, low risk, whatever, and write that incident security plan, then the next step is to test it, to do that tabletop exercise to see how we respond in a real world simulation. How are we responding, according to the plan, identify, discover vulnerabilities in that plan that we didn't realize until we tested it. The tabletop can also, it's designed to improve that communication and coordination in the case of an emergency. Who's doing what? How do we communicate? If we have to take our system down, what's our alternate communication path? Is it cell phones? Could be. So it tests all that, and hopefully the result is by doing well or learning from that, you boost your staff's confidence so that you feel more capable. As Rob said, I don't know. So here's your role in this incident. Here's what I'm supposed to do.
Chrissy Flake has a great comment. She says, as healthcare professionals, we need to look at cybersecurity, not just in the hospitals, but all areas where PHI and PII are kept. I think we would all agree with that. Thank you, Chrissy.
Absolutely.
For that.
Absolutely.
Wow.
Well, that speaks to, we talk about within the healthcare organization, what about the vendors, the suppliers, the whole supply chain issue? If there's vendors, suppliers that are integrated into your information system, what about them? What are they doing about risk?
We could have a whole podcast on just that vendor quality.
We may need to. Yeah.
Dr. Brown, it is another box that we check. We don't do it well.
Absolutely.
We need to validate, verify, and thoroughly audit our vendors.
Look at COVID.
Rob, are there any other questions from the audience?
We have a lot of comments on support. But as far as questions, none that we need to address here, but things that we can address in LinkedIn because we are out of time. Yep.
And for those who are listening, we will do that. Rob, can you tell the audience ways in which they can get at this podcast, maybe share it with others, or get more questions to us? I think that would be helpful to everybody.
Yeah, please feel free to reach out through LinkedIn, commenting right here on this post, and we will make sure to reach out to you. And Dr. Timothy Brown is a wealth of information when it comes to any of these things, and he will be happy to meet with you at any point. If you want to meet with any of us, you're of course welcome to do that as well. Reaching out to us via direct message in LinkedIn or any of our contact information that you see, we would be happy to provide any resource or support needed.
I want to thank Neal Harper for being our guest today. Neal, I wish we had some clapping noises we can give for you. Fantastic wealth of knowledge. I was excited for you to be on. Likewise, getting to know you over the last couple of months, it's been incredible to just get that amazing experience that you have in cybersecurity and perspective. Hope from the audience, you will seek out Neal with a lot of these questions directly. He can provide whatever you need. His business is phenomenal, all the way down to providing fractional CISO services if your hospital or healthcare organization needs it. I want to thank the audience for participating today. We had a lot of people sign up. I hope it answered a lot of your questions. Next month, we're going to be tackling nursing, specifically how do nurses protect themselves. And we're not talking about airborne diseases. We're talking about from lawsuits and the quality pressures that are being placed on them. So it should be a really good episode next month. So we hope that you will tune in again. So thank you, everybody, for sharing your time with us today. And we look forward to seeing you next month.
Thank you.
So with that, goodbye.
Thanks, Rob. Thanks, Tim.
Thanks.